I'm Chad Richards. I also compete in a sports league for people with disabilities. I dealt with a inguinal hernia for 2.5 years. It was quite rough, I would say. I would have to leave from work to go to the ER on a consistent basis to try to figure out why I was dealing with it.
The pain that Chad was experiencing had been limiting his workouts because he was a competitive athlete. And so all day, every day, this man was working out and feeling that pain, and he wasn't able to achieve the levels of success that he had been wanting to. So to treat the type of hernia that Chad had, he had what was called an inguinal hernia, so it's down in the groin. And generally the way that we treat it is either with watchful waiting, observing the symptoms that he has, but because it was so severe, I recommended a surgical approach. And those can be done either minimally invasive with 3 small cuts on the belly. So with Chad, we used sort of the newest and what I consider the best technique to repair inguinal hernias, which is a robotic approach. So we make 3 small cuts on the belly and blow it up and actually fix it from the inside.
I was truly blessed to have such a great doctor who cares and loves his patients. I was super privileged to have him a part of my life at that point.
Seeing the transition from before to after surgery is truly one of the most rewarding things. And for Chad, he sort of blew it out of the water. He went from feeling this pain day in, day out, limiting him in the sports that he liked to compete in, to going back to doing and excelling in what he loves.
All the nurses, doctors, physicians, everybody that had their hands on it was super nice. I was very, very blessed to have the doctors and nurses that I did throughout my surgery. Back in the game, ready to win that gold medal, and let's get to the USA Games in 2026. Let's go.